Monkeypox.
It hurts to exist.
The virus spreading across the country and in our community.
The district has the highest number of cases per capita.
We'll walk you through the symptoms, the spread, and the stigma.
Anyone can contract monkeypox, and this is important that we do not create stigma.
Plus, Dr. Anthony Fauci and his biggest concern about this virus. A WUSA 9 special report, Facts Not Fear. Stop the spread, stop the stigma, starts now. And thank you for being here with us tonight. I'm Lorenzo Hall. We begin with the facts. DC is reporting some of the highest cases per capita in the country. Today, we are at 248 cases. Virginia's Department of Health is reporting 116 cases so far. Maryland at almost 150. Now, the CDC reports more than 6,300 cases across 48 states. Most of the people getting sick are men who have sex with men. So how did we get here? Before we hear from our first expert, let's take a closer look at this virus itself. Let's start with the name. Monkeypox was first discovered in 1958 in monkeys being used for research, but it turns out they were not the source of it. They happen to be susceptible to it just like humans. Monkeypox belongs to the same family of viruses as smallpox, but is less contagious and not anywhere near as deadly. When smallpox was eradicated globally more than 40 years ago, health officials stopped vaccinating for it. And that's part of the problem now. The smallpox vaccine provides protection against other pox viruses, including, you guessed it, monkeypox. The last monkeypox outbreak in the U.S. was in 2003, but that was only 47 cases, all linked to pet prairie dogs. Those animals were infected after coming into contact with small mammals imported from Ghana. During this outbreak, monkeypox appears to be spreading through skin-to-skin contact with someone infected. It has an incubation period of usually 1 to 2 weeks and can start with a fever, muscle aches, and fatigue. After that, a rash develops, resulting in lesions. It typically lasts 2 to 4 weeks, and while most people recover just fine, children and people with weakened immune systems are at risk for serious illness. The U.S. uses 2 types of smallpox vaccines to fight monkeypox, and the CDC says anyone who thinks they have been exposed should get a shot. Now, monkeypox scars are both physical and emotional. Now we want to hear from 2 people who got monkeypox but struggled navigating their state's healthcare systems for treatment. The first one is Ryan, Washington State's first confirmed patient who does not want us to use his last name, and Wesley Wallace, who lives in Houston. And while both thankfully have largely recovered, we do want to warn you, this illness is graphic in nature, and you should know that some of these images are really hard to watch.
It hurts to exist. As you can see, from the time it started, it's just progressed and gotten worse and worse.
What Wesley Wallace says he thought was just a pimple turned out to be much worse.
Every sip, every bite, it's just like, oh, I can't, it hurts.
I had been traveling.
Ryan says he likely picked it up during a trip to the UK.
The symptoms were, odd that I didn't know. It was just like sort of some stuff on my skin. It was super scary, and I think the stress and anxiety that comes with that probably exacerbated the symptoms.
Both Ryan and Wesley say their local healthcare providers were not fully prepared to help.
There's a huge high-risk population that is just hungry for the vaccine, and they don't have access to it. I have friends that are actually buying airline tickets, flying to other cities just to go get the vaccine and then come home.
We have tools that can prevent the spread, and we're not using them to our fullest extent. And so that's what's tough for me to see.
It's such an ugly virus.
And Wesley says that, along with the pain and the symptoms, can come isolation. He wants others to know you are not alone.
I knew the stigma that might come with it, but I also know that lots of people are facing that stigma. They're not some kind of pariah, that they're not dirty. And that it's going to be okay. It's not lethal. It's just very temporary, and it's scary for the moment.
Joining me right now is Dr. Adam Brown, an emergency physician and founder of ABIG Health. Thank you so much for being here with us, Dr. Brown.
Thank you so much for having me here today.
So we know that DC is reporting among the highest rates in the country right now, and there's still a bit of confusion about exactly how monkeypox is spreading. Can you clear that up for us?
Well, yeah, so the most prominent way that we see that monkeypox is spreading is through a skin-to-skin contact. That's how the virus loves to move from animal to humans and now from humans to humans. Now, there is some evidence that it can spread via respiratory component. And so that's something we're going to have to watch. But so far, most of the cases that we've seen, not only in Africa, in Europe, and now here in the United States, have been through close contact, skin-to-skin contact. And of course, that can happen through a multitude of different activities.
Yeah. And you've had some patients with monkeypox. What are they saying to you? How do you even know if you have the virus?
Well, so far, most of my contact has actually been through telehealth. And so I've had patients come to me and say, hey, what is this rash? What do you think? Or they've said, hey, I've gotten diagnosed with monkeypox. Now what do I do? And so most of the patients so far have actually had fairly mild symptoms. But I want to be very clear. We use that term mild, and we've used that with COVID. And that can mean very different things for different people. When I usually use the term mild, meaning that it doesn't get you into the hospital. So most people have not had to go into the hospital. But they can have a lot of pain and discomfort with flu-like symptoms and discomfort over wherever the rash may be.
Yeah, not good at all. All right, so I instantly hear about these cases going up. We're heading into the fall soon. I know a lot of parents are concerned as well. How concerned are you heading into the fall months?
Well, I'm concerned for a couple of different reasons. To the first point about schools going into the fall season. Now, we do know that children can get this virus. They can also transmit it. We know that because in Africa, where the virus first was seen and found, children have gotten monkeypox before, and they transmitted it because of their close contact with their friends and school children. So we know that that can happen. So I have concerns that the monkeypox could get into children and into the community. So we're going to have to watch this very closely and broaden our surveillance to know whether or not children are getting it.
Now, do we know if children respond differently to the virus?
Well, that's an excellent question, because unfortunately, unlike COVID, children do worse with this virus. So if looking back over history, children have had higher levels of what we call morbidity and mortality. That means that they are more likely to get more ill or sick and even die from this disease. Whereas people that are adults, that are not immunocompromised, for example, have less likelihood of being in the hospital. So while we don't have a lot of children with this disease yet here in the United States, we need to watch this space very, very closely and contain the virus so that it does not get into our pediatric population.
I'm sure parents listening to you at home right now and hearing that, the alarm bells are going off right now. So what can they do to make sure their child is safe heading into the new school year?
Well, I think right now we have not seen a lot of cases with children, so I don't want to send off alarm bells yet. But they do need to stay close to the information surrounding this virus, meaning first, equip yourself with good information, not necessarily what's on social media, unless it's a trusted voice like a clinician like myself, but follow that closely and see what the case rates are happening within your community. Also ensuring that your school has plans for cleaning and quarantining and isolating in the event that someone in the school has this virus. So it's a watch and wait for parents at the moment, but they will need to watch this very closely.
So we know this isn't a new virus. So why are there so few vaccines available right now?
Well, first, it's a relatively new virus in that it was found in the 1950s, and because of widespread smallpox vaccination, which covers monkeypox, we saw the virus go away pretty much. But then in the late 2010s, in 2017-18, we started seeing an outbreak with human-to-human transmission in Nigeria. And so, unfortunately, there was not a strong response to contain the virus, which, as an aside, we need to focus on our efforts there. But there wasn't a concerted effort to stockpile large portions of vaccine. And so coming into this outbreak in May, the US government only had 2,000 to 3,000 vaccine doses. And the company that produces the vaccine, Bavarian Nordic, which produces the Jynneos vaccine, only has a limited capacity in their ability to make vaccines. So we only have 300,000 doses now and expected to get about 700,000 in the next few weeks.
But we know there is a vaccine that works, so that is some reassurance.
Absolutely. So unlike with COVID, where we had a full year almost for a vaccine to be developed, the vaccine is already there. It's highly efficacious. CDC reports that about 85% efficacy associated with this vaccine.
So how would you rate the government's response so far? You talked about Nigeria, how it sort of got out of control there, and I'm looking at what's happening here in the United States, and these cases are just going up at such an alarming rate.
Well, I think at this point we need to look at this in two different lenses. One is what is the local response. So here in DC, I'm really happy that the DC government has got out in front of this and that they've gotten vaccines to communities where the highest prevalence of disease currently. As a matter of fact, I was able to get my vaccine last week. So I feel very grateful knowing that DC was only allocated 15,000 vaccines for a population of over 750,000. But if you look back at the U.S. response in the last few years and how we've stockpiled vaccines, that's where my frustration lies, is that we knew that this virus was circulating in Nigeria. Granted, our attentions have been diverted to COVID, but viruses don't care about that. They can still circulate. And so we needed to have a stronger response, ensuring that we had enough vaccines in the stockpile so that when this popped up, we were able to respond very quickly.
And finally, any last bit of wisdom to the folks who are watching right now and they are concerned about where we're heading with this virus?
Well, I think there's a couple of things. One, I am hearing some people say, I've had chickenpox or shingles before, or I've had the vaccines. Am I protected? No, you're not. These are two very different viruses. The second thing is I am very concerned about stigma associated with this. Viruses do not discriminate. Humans do, but viruses do not discriminate. And as a matter of fact, our experience with HIV and with other viruses is viruses love when humans discriminate because it allows the viruses to spread undetected in communities without detection, without the resources. So that's where I have a worry about this virus, because if we overly talk about it just being something within a specific community, we have the potential of missing it popping up in other communities and contain the virus further.
So much great information. Dr. Brown, thank you so much. We really appreciate it.
Thank you so much for having me.
We are all about facts over fear, and we want to be a resource for you. Evan Kosloff is here to verify what you need to know about the monkeypox vaccine. Hey, Ev.
Hey, Lorenzo. Yeah, we're starting to see thousands of vaccines administered across the country. Listen to the numbers. The federal government has sent 388,000 monkeypox vaccines to the states so far, and it plans to send another 786,000 in the next few weeks. So we turn to the CDC and the FDA to get some fast facts about the monkeypox vaccine. The most common one is called Jynneos. It's made by vaccine company Bavarian Nordic in Denmark. Now, if you've been exposed to monkeypox, the sooner you get the vaccine, the better. And the CDC recommends getting the shot within 4 days to try and prevent the onset of disease. The vaccine is a 2-dose series given 28 days apart, and it takes about 2 weeks after that second dose to reach max immunity. Now, if you can't get your second vaccine in time and it's taking longer than 28 days, the CDC's Advisory Committee on Immunization Practices says just get it as soon as possible. You don't need to restart the series. As for those who can get it, the vaccine is only authorized for those 18 and older and is right now recommended for those who were exposed, those who have had multiple sexual partners in the last 2 weeks in an area with known cases, or those who are at a high risk of exposure, like certain laboratory and healthcare workers. All right, now DC Health, meanwhile, is doing something a little bit different. They're using what they call a single-dose strategy, prioritizing giving as many people who need it their first dose rather than scheduling second doses. Lorenzo, the hope is that down the road, when they have a greater supply, patients will be able to go ahead and get those second doses.
Yeah, hopefully too much time won't go by before people need that second dose. Evan, thank you. Joining me now is Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases and Chief Medical Advisor to the President. Dr. Fauci, thank you for being here with us tonight.
My pleasure. Good to be with you.
Thank you. Now, first up, CDC data shows cases are rising, especially here in the DC area. A lot of these local governments are saying they need more help from the federal government. They need more vaccines. So what is the federal government's plan of attack here?
Well, as you probably know, that yesterday the announcement was made that there will be a coordinator at the level of the White House, Dr. Bob Fenton, Mr. Bob Fenton, who is a FEMA administrator who has been very successful in the implementation of vaccines in an equitable manner for COVID. He's going to be the coordinator from the White House. The deputy coordinator will be Dimitri Daskalakis, who is a very well-respected physician, infectious disease expert, who used to be in the Department of Health in the city of New York, who is now with the CDC, who has very extensive experience and credibility, particularly with the gay community, in infectious diseases, to make sure that an all of government response really goes smoothly in getting the vaccines in an expeditious manner to those who need it, including those of us here in Washington, D.C. So I would expect that that addition to the all of government response that the president made yesterday is going to have an important impact on getting things done in an expeditious manner.
Yeah, on the same note, Dr. Fauci, we know this is not COVID-19. Monkeypox spreads differently. We already have a vaccine, but what are some lessons learned from COVID that are informing the federal government's response to monkeypox? Have we learned anything from this?
Yeah, I think it's important, first of all, to engage the community, which we are doing at multiple levels. I certainly, from the standpoint of the cities that are hit hardest, namely Washington, D.C. and Chicago and Los Angeles and New York City, is to make sure that we engage the community in making sure the implementation of the interventions that we have are expeditiously done. We have an unusual situation here. People often contrast and compare what went on in the early years of HIV, where we did not have a pathogen in the early years, 1981. It wasn't until 1983 and 1984 that HIV was discovered to be the cause of a syndrome that had been devastating mostly the gay community for 3 years up to then. We didn't have therapies, and we certainly didn't have a vaccine. Right now with monkeypox, we have diagnostics. We know exactly what the organism is. It's monkeypox. It's a virus that we've dealt with for decades, mostly in Central and Western Sub-Saharan Africa. We have a vaccine and we have therapies that we developed originally against smallpox, since this virus very much is in the category of smallpox, although it is much less severe. So the real challenge now is to expeditiously get those interventions to the people who need them, not only those who clearly know that they have been exposed because a person that they've had a sexual relationship with is someone with known monkeypox, but also those who generally are at risk, which is more of a pre-exposure prophylaxis with vaccines. So a lot of vaccines have now been deployed, many, many more than were just a few weeks ago. By the end of the week, we hope to get over 700,000 more vaccines distributed throughout the United States. And I believe that those of us here in Washington will have enough to be able to distribute to the people who need them.
And Dr. Fauci, how would you rate the federal government's response so far? Again, this is a virus that we're familiar with. There's already a vaccine, but it's taken so long to get that out to the people who need it.
Well, I think you have to put things in context when you say it was so long to get it out. If you look at what was asked for by the cities, which was mostly in a post-exposure prophylaxis, that the vaccines were gotten to them at that level. What we didn't have right off the bat, which likely we should have, would have been enough mobilizable vaccine to get it to everybody who needs it, purely because they're at risk, not because they have a documented exposure. So I think it's really much too early to give any rating of what the response is. I think we should need to wait to see how things go now that the vaccines have been more actively and aggressively deployed, and then give a rating as to see how things were done. I think it's too premature to do that right now.
Okay, what would you like to see happen from here, moving forward?
I'd like to see everyone who would benefit from a vaccine in a pre-exposure prophylaxis have that vaccine readily available to them. I'd like to see the drug, the TPOXX, that is a treatment for monkeypox, be easily available to the people who need it through their physicians and healthcare providers, and that the paperwork and the bureaucratic obstacles that may have existed get completely removed, so that it is relatively easy for someone to get treated rather than have a lot of paperwork. And I think already this is being addressed, and things are much easier now than they were, let's say, a few weeks ago.
So it sounds like you're confident that we can get this contained relatively quickly.
I hope so. I mean, If it's something that I do myself, I could tell you how confident I am in it. So the only thing I can say is I believe that the people who are involved in getting this done know the challenge, and I believe they'll get it done.
All right, Dr. Fauci, we know you also played a role in the government's ongoing fight against HIV and AIDS. And, you know, we're seeing some parallels here right now, a virus mostly impacting men who have sex with other men with the potential to spread much further. We know that. So how can the government fight any stigma associated with monkeypox, and why is that so important?
Well, it's very important because whenever you focus your attention on a demographic group, in this case, men who have sex with men, there's always the danger that there will be an element of stigma that is directed at the group that you're trying to engage and trying to help. So you have to walk a fine balance from alerting the community of the danger and providing them with the resources to counter that danger without pointing a finger and stigmatizing them. Because without a doubt, we know from very good experience, dating all the way back 40 plus years with HIV, that the true enemy of public health is stigmatization of the people who are afflicted.
Yeah. You know, we're told children are especially vulnerable to monkeypox. Are you concerned about that heading into the fall with schools reopening?
I think we have to take it seriously. I don't think it's a cause of panicking by any means now, but we absolutely must pay attention, close attention to that possibility, and make sure we do everything we can to prevent the spillover from a population that is 98% involved that goes outside that population. We need to take care of that group. At the same time, we prevent it from further spreading.
And what should companies do if someone in the workplace gets monkeypox? Is it a similar response to what we've seen with COVID-19?
Well, I think one has to first report it to a physician and get that person isolated, and then find out what kind of contact that person may have had. If they were not close personal skin-to-skin contact, then I don't think there would be an issue there. But what would likely happen is that if it's a documented case, you would vaccinate the people who were around that person in any way that they may have had personal contact with them.
Okay. And what is the efficacy of the Jynneos vaccine? We know a lot of people are getting that vaccine. So how effective is it? How long does it take to sort of build up that immunity?
Well, Jynneos is a 2-dose vaccine. It gives some immunity after 1 dose. By 28 days, you get good immunity, but you want to get boosted, you get durable immunity. Immunity of a vaccine usually starts 7 to 10 days after you get it. It can peak around 4 weeks or so thereafter. The reason for the 2 doses is to create a degree of durability so that the response goes higher to begin with and lasts longer. So that's why you do that. Now, the first part of your question was what? I just answered the number of doses, but what was the first part of the question?
The efficacy of this Jynneos vaccine.
Yeah, thank you. Well, the efficacy has been proven in an animal rule model because we didn't have monkeypox or smallpox at the time that the tests were done for the Jynneos vaccine. So you had to do it on an animal model, and it showed to be quite effective in the animal model. The FDA has a rule called the animal rule that when you show something is safe in the human and is effective in an animal model or 2 animal models, then you can give approval for that intervention. And thus far, that has the proof. So what we're doing right now is we're designing a trial. We've already started a trial in the Democratic Republic of the Congo, a randomized placebo-controlled trial to determine efficacy. And we will be starting a trial here in the United States to show efficacy here with the virus we're dealing with.
All right, so if you already have monkeypox, should you still get the vaccine?
Yeah, I don't believe you need a vaccine if you have monkeypox. The same with smallpox. Once you've gotten infected with it, the fact is you don't need it. However, that depends on how long after you've got it. If you've gotten monkeypox and recovered from monkeypox, then it is unlikely that a vaccine will give you a lot more protection. However, if you've been exposed and have monkeypox, there's a window of several days where the vaccine would be beneficial to you. So you've got to make sure you distinguish if you got monkeypox now, completely recovered, and then a month later, should you get it, versus I got monkeypox now, I have the early exposure, can I get a vaccine within several days of the exposure? That's not really getting monkeypox. That's getting exposed to monkeypox. So you want to make sure people don't get confused.
Right.
If you get exposed to monkeypox, you have a window of several days where you can get protected against it, even though you've been exposed to it.
Yeah, that's really good to know. And, you know, Dr. Fauci, we've heard from some people saying this should be declared a public health emergency nationally. Do you think so?
Again, I'm going to leave that up to the Secretary of Health and Human Services who'll make that determination.
Okay. Anything else you want to add?
No, we're good.
We covered a lot. All right, Dr. Fauci, really appreciate you. Thank you so much for everything you do.
My pleasure. Good to be with you.
We are back now with a WUSA 9 special report. Facts, not fear. Stop the spread, stop the stigma. The good news, we have a vaccine, but in D.C. there's high demand and very limited supply. So what's the plan with that? Joining me right now is Patrick Ashley, Deputy Director of Health Emergency Preparedness and Response Administration at D.C. Health. Thank you for being here with us, Patrick.
Thanks, Lorenzo.
All right, so what's D.C.'s plan to stop the spread here?
Yeah, so since the beginning of monkeypox, even before we saw our first case here in DC, we've been very aggressive about making sure that we were prepared for monkeypox. And that meant early on making sure that all of our partners understood what monkeypox was, and very quickly instituting contact tracing in the community, as well as jumping out ahead with our other fellow cities to do extended prophylaxis to make sure that we were able to get vaccines out into the community so that we could stop the spread very quickly.
Yeah, so when do you expect to have more of those vaccine doses? A lot of people want to know about that one.
Yeah, it's a great question, and we know that a lot of people are anxious to get vaccine. We've been very fortunate in DC that we've been able to get a good number of vaccines and been able to offer those through our 3 monkeypox clinics. Earlier tonight, we announced that we'll start having walk-up clinics each Friday as well. So we're very focused on getting the at-risk community vaccinated. We have enough vaccine on hand to start that process and continue to work with the federal government to be able to provide additional vaccine. We're also very cognizant of that our neighbors throughout the country also need vaccine to be able to stop this. Monkeypox is not limited to DC, and we're dependent on the entire community to stop the spread of monkeypox. And so we're very much looking forward to vaccine being readily available throughout the country.
And Patrick, with that walk-up clinic beginning on Friday, that's still for people who are eligible, right? Anyone can't just show up and get the vaccine.
That's correct, Lorenzo. Okay. I think, you know, there's a common misperception right now that everybody should get vaccinated, and we're most focused on individuals that are at the highest risk. We lay out that criteria that's gay, bisexual men who have sex with men and multiple or anonymous sex partners, transgendered women or non-binary persons assigned male at birth who have sex with men, sex workers or staff of sex clubs and other activities where sexual activity occurs. And the reason for that is we're very focused on being able to stop the spread within those communities. And as Dr. Fauci mentioned, we're very concerned about spillover into other communities. And that's why we're prioritizing those communities first. And so you do have to be a member of one of those eligibility groups as well as a district resident to receive vaccine in DC.
Yeah, and also we're heading into the fall month, so you're worried about a possible outbreak in schools, and if so, is it something you're prepared for?
Yeah, as Dr. Fauci mentioned, that spillover is something that we're very closely watching. We're having conversations to make sure that all of our teams are prepared for that. Our school teams, our universities are coming back in the fall as well. We're having lots of conversations with all of those partners to make sure that we're prepared. The most important fact here is that we want to make sure that we're prepared and get individuals vaccinated within those at-risk communities first so that we can prevent that spillover. And people ask me all the time, when am I going to be eligible for the vaccine? And my answer to them is, I hope that you never are, because the reality is that we don't want it to have spillover into other communities where people need the vaccine, right? And so we're trying to contain it within the communities that we're seeing it as quickly as possible so that the general population never actually really needs to worry about monkeypox.
All right. Patrick Ashley with DC Health, thank you so much for your time tonight. We really appreciate it.
Thanks, Lorenzo.
And, each area is responding a bit differently. Over in Maryland, for instance, Dr. Peter DeMartino from Maryland Department of Health told us they have 6,405 doses. They didn't have a total for how many people requested one, though. Virginia health officials say they've received about 22,000 doses and about 7,000 people have requested one. But will that be enough if the virus continues to spread? We took that question to Virginia's Secretary of Health and Human Resources, John Littell.
On August 3rd, it is. On September 3rd, probably. On October 3rd, I don't know, right? And I think that's one of the reasons why the federal government went ahead and pre-ordered so many vaccines. I mean, the number that they ordered is likely significantly larger than what we will ever need.
Yeah, and by the way, in both Virginia and Maryland, you can get the vaccine through your local county health departments. We heard from a lot of you before tonight's broadcast, and for many, the big concern is the stigma surrounding this virus. And I can't say it enough. It does not just affect those who are LGBTQ+. Anyone can contract monkeypox. I spoke with the chair of Howard University's Political Science Department, Dr. Robbie Perry. He has HIV and has studied the U.S. government's response to the HIV/AIDS crisis extensively. Dr. Perry says this reaction to monkeypox now is parallel to the government's response to HIV and AIDS in the late 1970s and early 80s. HIV and AIDS was depicted as a gay disease because gay men were the group primarily impacted at the time. With monkeypox, he says there's a similar depiction, and that will have long-lasting consequences.
It will, lead many to believe for many years to come that, their perhaps, latent suspicions about the inferiority or the uncleanliness of certain groups is in fact founded in some version of truth. And we don't want I think, medical science to be an indirect victim of our social and cultural wars.
Yeah, so a lot of people wondering now, what comes next? It's on all of us to keep talking about this openly and without judgment. That is critical. That is how we stop the stigma. If you are eligible, get your shot. If you've had your first, get your second one when it's time. Thank you so much for joining us for this WUSA 9 special report. I'm Lorenzo Hall. I will see you back here tonight at 11. Have a great night until then.